Hi, Oaklawn. We're here in Channel 4 studio today with Dr. Scott Garrity at Advocate Christ Medical Center and Dee Behrens. Now, doctor is the neurointerventionist, and I want to ask a little bit what that is because I bet most people have never heard of that. And then Dee, you're the stroke program manager.
Correct.
So we're here today to talk about probably an issue that we all hope we never have to deal with, but unfortunately, a lot of us do, and it's so important to understand what it means, what to do, and understand the great resource we have right here in our own community that can help you. And so we're going to start introducing you first, Dr. Scott. Can I call you Dr. Scott?
Yes.
Is that okay?
Yes, please.
Okay, so what is a neurointerventionist?
It's funny you ask me that because I've been doing it for 8 years and I still struggle to fully explain that. A lot of times I have to defer to my wife to kind of sum it up in a more concise way, but it's a specialized field where I treat, mostly stroke as well as, ruptured brain aneurysms, carotid artery disease. It's a minimally invasive field. It's a subspecialty of radiology, neurosurgery, and neurology. So everything I do is very minimally invasive.
So you're the man we want to know when we're having the worst day of our life.
Exactly, and that's the way I say it to a lot of people is, you hope to never see me in my work setting, but if you do, you'll be in good hands.
Yeah, that's good to know. And then Dee, tell me what you do.
So I organize and run the stroke program that we have at Advocate Christ Medical Center. We are a comprehensive stroke center. So that means we give the highest level of stroke care. Most complex strokes come to Christ due to the infrastructure of having neurosurgery, neurointerventionists. Dr. Garrity doesn't give his accolades enough in the fact that there's not many of them in the country, and we're lucky to have the ones we have here on the south side.
That's wonderful.
So we do service
right in our neighborhood. Yeah.
Correct, right in the neighborhood, and we do service then, the south side area because patients get transferred into us for their higher level of care.
Now, many patients or many people watching this, many residents, may have had a stroke or know a loved one who has a stroke, but many have never had this experience at all. Can anyone tell me what exactly is a stroke?
Sure, I'll let you take that, Dee.
Okay, so a stroke is a blockage in the blood flow to the brain. The brain gets deprived of blood flow and oxygen. The majority of strokes are what we call ischemic strokes, and that means there's been a blood clot or plaque that's blocked off a vessel. It's blocking off the blood flow. The blood flow is being deprived to the brain is dying.
So is the plaque like a chunk of cholesterol or inflammation or anything?
Yeah, it can be cholesterol from your carotid arteries, cholesterol in your brain, cholesterol from your heart, as well as just clot. Blood clots form in all these areas too, and it finds its way up to the brain.
So that's the most common type. What are the other types?
So then that accounts for about 85% of all strokes. 15% of strokes are hemorrhagic strokes. And they occur either because there's been we call it like a little bubble, an aneurysm on the outside of a vessel. I always say to people when they're trying to visualize what that is, think about your garden hose, and it gets a bubble on your garden hose, and at some point that's going to burst.
If you think of the cartoon garden hose in particular, that just kind of goes, whoop,
Yep.
Exactly.
Yeah.
And so that is when an aneurysm has burst. And that's kind of where Dr. Garrity's specialty comes in, is hopefully we catch those before they burst and go in and take care of them. And then the other thing is just due to hypertension, primarily is the other type of hemorrhagic strokes and cranial hemorrhage strokes. And that's just due to the vessel walls getting weak and bursting.
Wow. Now, who has strokes? Who's at risk?
Well, technically everybody.
Everyone.
Babies in utero can have a stroke.
Oh my gosh.
Yes, so it is actually a risk factor for everyone. Yes, there are more that are more at risk than others. We talk about modifiable and non-modifiable risk factors. Non-modifiable risk factors is unfortunately every decade after the age of 55, your risk doubles. So age plays into it. If you have a family history, if you've had a stroke in the past before, it puts you at risk for a stroke. African Americans tend to have more than Caucasian. Those are what we kind of consider the non-modifiable risk factors. And then the modifiable risk factors and those that are at risk are those that have high blood pressure, diabetes, high cholesterol, obesity, smoking. So everything that goes along with cardiac risk factors really do go along with stroke risk factors.
So keeping a healthy body really makes a big difference when it comes to stroke.
Absolutely.
And unfortunately, we see it in some of the younger population that's due to recreational drug use.
Thank you. Doctor, how do you know if someone's having a stroke? Like sometimes I'll be talking with someone and they just look like they're struggling, and it's typical, out of character. Maybe they have a cold. I don't know. What do people look for? How would someone at home know?
There's a mnemonic that we use that doesn't encompass every stroke, but it's certainly something that everyone should know. It's called FAST. So F being facial drooping. So if you're talking to a relative and suddenly you notice half their face is drooping, it might be nothing, but never overlook that sign, because it could certainly be a stroke. The second thing, A, is for arm. If someone suddenly experienced arm weakness, it could be hand weakness. There's no reason to suddenly not be able to move your arm.
Is it always on one side, or can it be on both sides?
It can be on both, but traditionally stroke affects one side or the other. But just because it's affecting both doesn't mean that stroke is ruled out. But traditionally it would be one side. And then S is speech. So obviously if someone is suddenly talking in garbled words, or just can't find the words that they want to say, that could be a sign of stroke. And then last T is for time. Time is brain. If any of these symptoms, this is not something that you want to sleep it off, take a nap, see if it goes away. As soon as any of these symptoms, you have them, a relative, someone that you're talking to has them, get them to a hospital.
Right, and don't be afraid to call 911. Do not drive yourself. I was just having a conversation that people will try to drive themselves, and just let the professionals get you there quickly. Because not only will they get you there quickly, but the professionals will get you into who you need to see quicker than if you go check in at the reception area and the intake has to process you. If the medics take you in they're going to know exactly where you need to be and alert you. And so FAST, that's a good acronym. Now FAST means get there fast too, right?
Correct.
So what's the window of time? It used to be like if you didn't get there quick, there was nothing. Is that still how?
Well, that's what's remarkable about stroke today. You always need to get there quick because you're losing, millions of brain cells immediately. So the quicker you get there, the better your chances of having a good outcome. But what's remarkable, or really just in the last 5 to 10 years, we've been able to expand the time window. It started being 3 hours, then it stretched to 4.5 hours. And really just within the past 5 years, we started being able to do endovascular treatment of stroke, meaning if you have a large vessel stroke, someone such as myself can go up there and actually pull the clot out of the people's brains.
Wow.
And it used to be we could do that up to 8 hours, and there's been some recent trials. So we can now treat stroke up to 24 hours.
But you don't want to wait 24 hours.
You don't want to wait 24.
Because every minute brain cells are dying.
Every minute brain cells are dying. And this is something, this kind of technology can't be done at every hospital either. So, stretched it out to 24 hours based on technology at our comprehensive centers to make sure that we can treat people up to that extended time window.
Can those brain cells that die grow back?
So they don't.
Is it gone? Is it once?
So brain cells that have died don't grow back, but what the body has an amazing ability to do is kind of form new connections. I like to tell patients, if you close a highway, that you hope that they'll build a detour around that, so things can get where they need to go. So brain cells that are lost, but your body can form new connections, and that's why people that have had a stroke can continue to heal and improve for even up to a year.
That's incredible.
Yeah.
That's incredible. Now, I just want to share some facts about strokes. It's the 5th leading cause of death.
Correct.
And that's astonishing. And do you want to talk
But
about
worse
that?
to that, I think, and the reason that I think in stroke care we have a long way to go in making improvements is it remains the #1 cause of permanent disability in the United States. And I think that's more impactful. When I first started out in the stroke program in 2004, it was the 3rd leading cause of death. So yes, we've done some remarkable things. We've moved it to the 5th, but it remains the #1 cause of permanent disability. And partially it is because we don't get people in soon enough to treat.
So if you're eating dinner or sitting across the table from someone and they look kind of different, what can they do at home? Like, can you ask them to do, like, raise both arms, or is there something that,
You can. It kind of goes along with the fast message.
Yeah.
Have them smile. Ask them to repeat a couple words. It's a sunny day outside. If it doesn't sound right or they're not even comprehending. And unfortunately, sometimes and especially in the elderly population, we get that they don't recognize it being an emergent because they're all of a sudden confused. But that confusion can be masked because they've lost their language center. And they're now, if your mother is 87 years old and is sharp as a tack all the time and is suddenly confused, it could still be a stroke because it could be coming from her speech. So it's really recognizing those signs. So it is, put their arms out, have them put their arms out, have them smile, just one side crooked, have them repeat a few words. And then if any of those are positive, it doesn't have to be all of them, one of them is positive, it is time to call 911. And what we also ask of you then at that point is to note what time it is on your watch. So the T kind of stands for two things. We need you time to get to the hospital, and we need the time of onset, because that's how it drives our treatment process.
that's wonderful. Now, let's say, God forbid, someone has one of these ischemic strokes. What treatment options do they have? What are their options from there? What do they do? What do you guys do?
So it starts with, first we evaluate, are they in the window for alteplase, which is a high-dose anticoagulant that can be utilized out to the first 4.5 hours. There's a lot of criteria that eliminates people from that based on their history, based on what medications they're on. So we have first evaluate for that, and then we also at the same time are evaluating. So when they come in, we're doing some imaging to see what the vessels look like. And by determining if there is a clot in the vessel, that's when Dr. Garrity and his team would be called in to then potentially go in and remove the clot.
Yeah, well,
Yeah, so the alteplase, a lot of people know it as, clot busting medication. It breaks up clots, but one thing that we've learned over the years is that when you have a very large clot, it's generally not that effective. You should still get the medicine, but typically from that point, when you have we call it a large vessel occlusion, then you proceed to, advance in the chain and see me, where I have to go actually pull the clot out because the clot busting medication is probably not going to work at that point. So, at that point, we move on to what we're calling thrombectomy, which is where I can go and actually pull the clot out. The clot busting medication can only be used up to 4.5 hours. So again, important to get in early. My treatment can potentially be done up to 24 hours, but again, sooner the better.
how long is someone usually in the hospital for a stroke? And
It
then-
will vary. It varies on if we were able to treat early on. Because if we can treat early on, then hopefully they're left with minimal deficits. We can get them in and out in 3 to 4 days.
Holy cow.
Because we have had patients that have come in completely unable to speak to us, not being able to move one side. We've had treatments and they're going home in 3 to 4 days.
Wow.
And then
Great time to live in the village of Oak Lawn.
you know what? It really is. And to your point earlier about calling EMS, we've partnered with EMS, and the EMS here in our community is wonderful. They acknowledge we've done a lot of education with them. And when you talked about getting to the right person, they call ahead. They call into us and they say, we have a patient with stroke-like symptoms. We are on our way. So at that point, we activate our stroke team in the emergency room. So a lot of times we walk down there and we're waiting for them to walk in.
It's wonderful.
So
And then response times are quick
They are.
also, and minutes count.
They are.
That's great. Now, when someone, do you help coordinate the therapy then that they're going to need when they're in recovery mode and the event is passed? What happens then?
Correct. So they get a full evaluation when they come in. We do an entire workup because primarily one of the big things that we want to do once a patient has a stroke is we want to find out why they had a stroke. Because we do know that you're now more at risk, so we want to find out what caused it. So there is a workup to it. We do imaging of, the carotid arteries. We do some lab work. We do some workup to see if we can determine. Some we can't, but we try to figure it out so that we can then modify your risk factors. 80% of strokes are preventable by knowing and treating your risk factors. So if you were never treating your blood pressure and your cholesterol and now you had a stroke, hopefully we can prevent you from having another one because we're going to help you manage your cholesterol and your blood pressure and those things. And then we do get therapies on. Therapies are brought on early. We evaluate if they'll need inpatient therapy, if they'll need therapy at home. One of the additions we've also added just recently within the last year is we do have a nurse-led follow-up clinic in our outpatient pavilion. So we're seeing a lot of those patients that didn't have deficits that required them to go on to a skilled nursing facility or to a rehab, but went home but still need a little bit of re-encourage. We're bringing them back in then in our stroke TIA clinic.
That's great. That's great.
Yeah, it's a big win for us to have that clinic and seeing people once they get home.
Yeah.
Yeah, and then to add on to that, I mean, you asked about therapy. We have inpatient therapy at our hospital as well for people that need that. And really, even though my role with stroke is the immediate treatment of someone having an acute stroke, stroke, we're kind of with you forever on that. I mean, Dee actually runs this wonderful stroke support group where people who've had strokes in the community come and meet. How often do you meet?
We meet once a month. It's the third Wednesday of the month from 6 to 7:30. There's no registration. It's in our outpatient pavilion. It's for survivors and their caregivers.
So if someone who wasn't treated at Advocate had an interest, they could still attend?
Welcome to come.
So let's roll back when that is and where
So it is
to find it. And
the stroke support group. You can always call the main hospital number, 684-8000, and ask for
848,000. Say it slow.
Sorry, I'm sorry. Yes, 684-8000. You can ask for the stroke coordinator. That will connect you with the stroke coordinator. They can give you more information. Everyone is welcome. It does not matter if you were treated with us. We have also had significant others, caregivers of survivors, come on their own because they're looking for support and maybe their family member hasn't made it home yet, or they're still in a facility, or they don't want to quite come out yet. So we offer a lot of support to the caregivers too. So it occurs in our outpatient pavilion, which is right on the corner of 95th and Kilbourne, in the community room from 6 to 7:30 the third Wednesday of every month.
Okay.
And it's open. It's open to anyone.
And is it free?
It is free. There is no registration. We provide refreshments. And we, most importantly, provide connections for them. Most of my survivors then, after they leave me at 7:30, end up having a little coffee club at Huck Finn on Cicero on their way home. So they've created great connections.
Because it's easy to feel alone, and if, what do you do? How do you connect? How do you deal with this? And it's challenging on many levels.
Correct.
And just someone saying, oh, I had that problem and I did this or used this resource, it's a huge, huge help. So
We have a show and tell usually once a year where I have them bring in their gadgets. And they show how they open up jars at home and how they do those things. So exactly, it's learning how to get on at home again.
So I want to talk just a little bit about mini stroke versus stroke. Someone will say, oh, I had a mini stroke. What does that mean? Is that different? Should people be worried if they're having mini strokes?
Yeah, so the mini stroke, otherwise known as transient ischemic attack or TIA, it is the type of stroke where your symptoms are gone within 24 hours.
Okay.
The most important thing to know about this is that it is the biggest predisposing factor to having a bigger stroke. So absolutely, of every symptom that you can have not to ignore, it's if you've had a prior mini stroke, your chances of having a major stroke are significantly higher. So definitely do not ignore those. Even if you have it for 15 minutes and you feel like you've completely recovered, at the very least, see your doctor the next day. Bring this up. This needs to be evaluated to find out why it happened to prevent things from getting worse.
What are the most common signs of a mini stroke?
They can be similar to everything that we've talked about. Certainly don't have to be as dramatic as not being able to move your arm at all. They can be simpler. If I'm having numbness and tingling in my fingers that there's no explanation for, or the occasional facial droop that I got better.
And I see patients where the vision will just slowly fog or fade and come back, and those, you got to get that checked out.
I was just going to say that's an absolute indicator. A lot of times for someone that has disease of their carotid arteries, we call it kind of the shade going down. If you're having that again, that clears up immediately, but that's a sign of a potential, major stroke brewing. So do not ignore that.
So someone is got the risk factors, let's say their blood pressure's a little crazy, their cholesterol not too good, they're diabetic, and they're several decades over age 55. So they've got all these risk factors. What should they be doing to prevent it? You know, I mean, do you have referrals if someone didn't have a physician, for example? How would they go about getting one? Can they call that number again?
They can, and they can get connected with Physician Link, and they can
Okay.
partner up. And, you know, advocatehealth.com, getting on the internet will direct you to finding a physician.
Okay.
So if you utilize advocatehealth.com, and it will direct you to picking your area, putting in where you live, and then directing you to a physician
Okay.
within your area. And,
Yeah.
and it's know your numbers. So to your point, yes, they need to get in. They need to, the best way to prevent it then is to know your numbers, keep your numbers under control, your blood pressure, your blood sugar, your cholesterol, diet, exercise. American Heart Association.
You're no fun.
I know. American Heart Association says 150 minutes a week of just moderate exercise. So all that means is get out and walk around the block.
That's good.
Get out, walk around the block. All of those things help decrease your risk.
So stroke is preventable.
80% are preventable.
That's good news. Now, I want to talk a little bit about the differences between stroke centers, level of care. Who wants to talk about that? And what we have in our community here.
So what we have here in our community is here in Oak Lawn, we have Christ, which is a comprehensive stroke center. As I said earlier, it is the highest level of certification. Stroke centers can be certified at 3 different levels. An acute stroke ready hospital is basically a hospital that, yes, they can administer TPA, and they will care for you. Alteplase, I'm
Okay,
sorry.
the medic.
We're trying to get the clot buster. We're
The
trying to get away from using the
Yeah.
initials.
Yeah.
TPA, Alteplase, it's the
Yeah.
same thing. It's that clot buster. They can administer that, but they usually do not have a dedicated stroke team or a unit, so they transfer out immediately. As a matter of fact, Payless is an acute stroke ready. And then we have primary stroke centers, and those have teams. They have stroke units. They can administer the Alteplase, TPA. They can do some of the advanced imaging. They can, if it's appropriate, keep those patients within their facility and do the whole workup. But if they find then that they need advanced care, they'll go to the comprehensive center, which is what Christ is. We are actually the only certified comprehensive stroke center in Region 7.
Region 7 is
Our EMS region.
So how big is that?
So we go all the way down to Kankakee.
Okay.
so-
How far north?
So we go as far as Payless, Worth, and then we go down to like Kankakee.
So, you know,
Like
if,
little company sits in they actually sit in the fringe of our region. They're between 2 regions.
so when minutes count, it's more important to get into one of those more highly trained centers.
Potentially, and
Yeah.
and that's why we do a lot of education with EMS in this area. You know, not even just our Oak Lawn Fire Department, but all of the EMS providers within the region, because they are the best at knowing. They tell us, no, we looked at this and we knew that was a significant stroke, and they will help determine that. You know, kind of talking about the EMS providers that we do so much education with, and they are so knowledgeable out there in the field to help try to make that decision. It's, you know, Dr. Garrity talked about the TIAs. They have encountered patients that they get to, and because the symptoms resolved, they want to stay home now. And the EMS providers have been educated with, you don't want to do that.
Yeah.
So that's why, you know, the 911, they can help try to drive the care into the best, most appropriate center at that time.
Yeah, and but it's also important to, you know, bring up that as a patient, you can decide where you want to go. And I always tell my parents they don't live here, they live in Denver, but, you know, I say if you're having what seems like a bad stroke, you know, you can't move your arm, you know, I tell them to go to a comprehensive center because the services that I offer are only at comprehensive centers. If you go to another hospital, absolutely you can get transferred over
But
to
then it's more
comprehensive.
time and
It's-
more
it's
complication.
more time, so
Yeah.
so you have the ability, you can choose where you want to go, and we certainly toot our own horn of the comprehensive because we can do it all for stroke patients.
Yeah, well, we're very proud of what is done in Oak Lawn at Advocate Christ Medical Center, and what started as a little sleepy neighborhood hospital, it's astonishing and nationally recognized. So I just want to ask you, Doctor, so I want to talk about your training. So how are you different? So you went to medical school, so you got your bachelor's degree, then you got your 4-year MD.
Correct.
Then what'd you do after that?
So after that, I did an internship, which is just general medicine for a year.
Okay.
And then I went and I did 4 years of actually radiology training and, it's imaging, CAT scans, MRIs, everything of that sort. After that, I did a 3-year fellowship, just specifically in what I do, so neurointervention, of just dedicated training, essentially in treating stroke, brain aneurysms, and the diseases of the neuro.
Yeah, so that's quite a bit of training. You're
So
definitely
8 years after college, after med school.
Yeah,
8 years after med school.
Yeah, so not everyone who treats stroke has that level of expertise, and you're one of a few doctors on call with this level of expertise, correct? Or is this your unique?
Well, within Advocate, the entire Advocate system, there's 6 of us that can do this.
Holy cow.
For the most part, Advocate is a huge system spread everywhere. At Christ Hospital, there's about 2 or 3 of us that you could expect to see that do this sort of procedure.
So even if you come at 2 in the morning on a Sunday, someone is standing by ready to help.
So someone is always ready. We're 24/7 to treat stroke.
Yeah, very good. I guess I'm going to open it up. I've asked you guys a lot of questions. Those are kind of the things I wanted to talk about, and anything you want to tell residents that we haven't talked about?
It's just for them to understand that if they have signs and symptoms, they need to act. You need to get in. You need to call 911. Even if it turns out not to be a stroke, let us determine that, because the longer you stay home, unfortunately, there's nothing worse than when we walk down into the emergency room and we greet a patient and then we find out that the symptoms have been going on for 2 days, and because it didn't cause pain, and stroke doesn't usually cause pain, it's a sudden loss of something. It's a sudden loss of use of their arm or their leg or the ability to speak. And because there was no pain involved, and I've done community events here in the library, and I've had patients say, well, I only came because my wife called 911, and I've asked them, if you had crushing chest pain, would you have called 911? Well, yes. Well, it's the same idea. In a heart attack, the heart is being deprived of blood flow and oxygen, and stroke, the brain. It's a brain attack. So it needs the same level of emergency. And that's the way we treat it once you get to our door. It's the same level as if you are coming in with a chest pain. Treat that brain attack. And the only way we're going to change it from the #1 cause of permanent disability is truly to get people in, and in time.
So our goal with this video today is, if you or a loved one, God forbid, is noticing any of these things, do not wait. Just call 911. Let our excellent paramedics come and take you to this great team we have right in our own neighborhood. Don't second guess it. Don't wait to talk to your daughter next week about it.
Let us be the ones that do the workup. You certainly hear about there's information out there, and people come in 10 hours later and say, "Well, I didn't think you could do anything." Let us be the ones that can decide that, because there's certainly so many situations where we can help people that you just never would realize it.
And there's new things being discovered and new advances all the time, and we can count on you guys to stay on top of it. So we really appreciate that. I learned a few new things today that, in my training we didn't have, and I'm thrilled. I'm excited about that. So let's say I was one of the 6+ million survivors of a stroke. Is there anything that can be done a year later, 2 years later, to help me use that hand again, or that arm, or speak? Or is there any progress on that still, or are we far away?
So interestingly enough, there still are a lot of studies going on in the rehab world. And, one of our neurologists at the hospital, Dr. Wichter, always says that he tells people that they'll get 90% of back what they're going to get back in 90 days. But that 10% is always that part we don't
The
know.
last 10% every
It's the
time.
last 10% that we never know, and I have had stroke survivors, and, you know, as we talked about the stroke survivors group, I have had survivors there that when I first started coming there, one of my favorites, she could say no, that was all she could say, and every once in a while, she will come out with a few new words when she comes to see us during a month. So she's done different projects. A lot of my stroke survivors get involved in some research that goes down at some of the rehab centers downtown and things that are doing trials. They do reach out to stroke survivors, even ones that are, you know, far out of the window, to see what they can do. So we never say never. We never say give up. The more you keep trying to use it, as we said earlier, it's the brain retraining itself.
Right, right.
We never know which one's going to connect.
And utilizing that support again. So, you know, maybe 6 years down the road, you might not be able to get your arm strength back, but just knowing that you're not alone, this is the number one cause of disability, and being able to meet with other people that have the same issues can make it worlds better, and knowing how other people deal with it and getting that camaraderie.
So a 35-year-old could have a stroke, a 1-year-old can have a stroke.
Absolutely.
Generally, we think of it as a condition of our senior population, but it doesn't have to be. So learn this video. It can save your life. It can save your loved one's life. And
We've also taught it to children.
Yeah.
So we've gone out and actually have partnered with District 123, your district here.
I love
and
them,
we
yeah.
went out and we, last year, had educated 3,200 of the grade school kids from kindergarten through 8th grade. We did the fast message. Just share with you really quick one of my favorite stories. I had a first grader, and one of the things they say to me, well, how does a stroke happen? I said, well, it's your brain can no longer tell your arm to move anymore. Something happens in your brain. He sat there for a second and he said to me, so it's like texting without internet service. And I was like, okay, but they can get it. They understand it. So even if you're home with your grandchild and they say, Grandma, you're not right, I think you're having a stroke, we need to call 911. Listen, we have had a case where we had a 7-year-old that called 911. Dr. Garrity took her to intervention and she went back home.
wow, that's great.
So
That's great. So strokes are survivable. Get in right away. Get into a center that has the expertise that's going to make a difference for you. And call 911 if you have any concerns. Any last words?
No, I mean, I think that sums it up. You know, stroke is treatable. Stroke is survivable. It's just don't ignore it. Make sure if there's any symptoms, as I said before, let us be the ones to decide, you know, if it's a stroke or not. There's certainly no shame in having something that's not a stroke, because the thing that's the most devastating to me is not the patients, you know, that I see that I can't help. It's the patients that I hear about a day later that no one bothered to come in and be seen by me, and I know that, well, had they come in, I could have helped them. That's the hardest.
Yeah.
yeah, that is what's, you know, and we have had many people here in this community that we have helped get back to their lives. Those are who we see in our support group, and that is always what I think makes Dr. Garrity especially get up at 2 o'clock in the morning and leave his home to come in and to treat that, is because it is that we get people back to their life.
Yeah. And that's really what it's all about. And that's
Absolutely.
wonderful. And can you give us that phone number again for the, if someone has questions about your programs,
Sure.
you know?
Sure, and I can actually direct them to my direct phone number if they have questions about stroke. If they have questions about, you know, we're always available to come out to people's church groups to do stroke education or anything like that. So they can reach me, D, at 708-684-4472. That's 684-4472. And that's directly to my office. And you can leave a message and be happy to get back to you.
So anyone's church group,
Anyone's church
club,
clubs.
service, whatever, yeah.
We believe it's we have to get the message out about signs and symptoms and getting in. So if we do it one person at a time, we always ask when we go out, we give them the information, we ask, share it with one more person. If we can just keep sharing it with one more person, we're going to make an impact on that number one cause of permanent disability.
Well, Dr. Garrity, I want to thank you for coming to our Channel 4 studio
Yes,
here.
thank you for
And
having us.
Dee, it's just a pleasure having you as well. And I want to give a shout out to our Bureau Chief Wheeler for helping to organize this, he saw that this was something we wanted to get out in the community, and he really worked so hard behind the scenes
did.
to make this happen. And so we're hoping to bring more programming from Advocate Christ Medical Center to Channel 4. And so you guys are kind of the first of the wave we hope to do. And
Great.
I want people to know what a great resource we have, and the talent. I mean, seriously, who goes to that much college? And you still look like 22 years old. Like, how did that happen?
I'm older than I look. I'm unfortunate that way.
Well, it's okay. Thank you for coming by.
you for
And
having us.
remember FAST, F-A-S-T. Okay. Thank you.
Thank
Thank you.
Okay.